Pregnancy and addiction is what I will be talking about today. Maybe we can talk about prevention rather than a reaction. Imagine baby Jaden. He was screaming, shaking, and clawing at the nurses. This is what neonatal abstinence syndrome looks like, or NAS for short. He spent 35 days in the intensive care unit. Moms who have babies that are born with opiates in their system, there's a lot that results. The baby will go to the NICU for withdrawal symptoms to recover. The child services will come to make sure the home is okay. The mom may lose their child if it is not okay. Developmental delays could possibly result from the withdrawal, and the baby will probably go to foster care, which the state pays for. The babies going into intensive care units is $3,000 a day. That meant that it would have been $105,000 for baby Jaden to be in the neonatal intensive care unit. Employers pay $2,830 for a full-term healthy baby to be born. Medicaid covers 70% of births in New Mexico, and most of these mothers having babies with opiates in their system are on Medicaid. The cost of neonatal intensive care unit nurses, it goes just for one nurse, $30.64 an hour. That meant if one nurse was there the entire time, it would have costed $12,368.80 for baby Jaden to be in the neonatal intensive care unit. NAS babies born in New Mexico has been going up. In 2011, it was at 6.1 per 1,000 babies to 10.3 per 1,000 babies in 2015. If we look at the cost perspective versus how much it is, it's $3,000 a day for a baby to be born and going into the neonatal intensive care unit. It costs $30 to $50 a person to be drug tested. So we would have spent $1,389,750 in 2017 just for drug tests. But if we figure the babies born, if they just spent one day in the hospital, would have gone over that 3 times over. If we look at the rehab, yes, it could cost us money, but it's less than what it would cost us to send them to the neonatal intensive care unit. It's $15,000 for someone to go into the rehab for 30 days. And they have options for low income and no income households. But you figure just for $3,000 per visit in the neonatal intensive care unit versus 30 days in a rehab center, it's better to prevent than to react. Getting these mothers help is not only good for the mothers, but it's good for the state. The mothers will accomplish a possible sobriety, and the baby won't have drugs in their system when they're born. That means there's no NICU stay. Human Child Services don't get involved, and they possibly reduce the amount of babies that are going into foster care because these mothers now can take care of these babies. Maybe it's time for a change and we look at a prevention rather than a reaction.